Hello friends, did you know? Even after working for a long time in any field, sometimes it becomes difficult to answer a basic question related to your own field. Because while working on daily basis we only focus on our core job and never pay much attention to enhance our knowledge. This makes us to feel shameful in front of new joiners or less experienced teammates, but you don't worry about it because I bring a solution in my new video for those who are working in medical billing. So, friends, before moving forward to this video, myself Virendra Singh Rathore welcomes you on my channel and requesting you all to subscribe my channel if not done previously. Also share this video and my channel with your friends so that they can also get knowledge about medical billing by watching my videos. Your like, share, comments always motivates me to bring the best contents to enhance your knowledge. So subscribe my channel to get notification of new videos. In this video I have covered the topics which are normally included in US healthcare training when someone join a medical billing company. The topic which I covered in this video will be helpful for those who are working as trainers and those who are planning to appear for a medical billing interview. There is long list of topics, so please watch this video till the end. First page of content. Second page of content. Third page of content. Fourth page of content. Let's start with the first topic of this video. Provider. In medical billing service there are three parties involved in whole process: provider, patient, payer as insurance. Provider. Let's start with provider. The provider word in medical billing is used for the person entity who provides care or services during any illness or medical condition to a patient. Normally these providers are called as rendering provider, referring provider or primary care physician. Let's understand the difference between these different names. First, we understand who is the rendering provider. Rendering provider. A rendering provider is an individual provider who renders services or care to a person patient. The rendering provider is face-to-face with the patient in most circumstances. Second is referring provider. An ordering referring provider is the individual who orders or refers an item or service for a patient. Example: laboratory diagnostic tests, imaging services, specialty services, durable medical equipment that will be furnished and billed by another provider or supplier. Example: laboratory, imaging center, etc. Third is primary care physician. A primary care physician, PCP, is considered as a main doctor who is responsible for dealing with the majority of healthcare issues of a patient and refers the patient to other provider or physician in case a specialized treatment is required. PCP is also called as referring provider. Next topic is patient. Let's understand. Patient is the person who is seeking services from providers. The patient can be an insured, dependent or beneficiary. Let's understand it step by step. First, understand who is an insured. Insured is a person who has purchased a healthcare policy plan from an insurance company to meet his or his family's healthcare expenses. Now understand who can be the beneficiary. A beneficiary is a person who is taking healthcare services and the expenses for these services are paid by insurance. A beneficiary can be an insured or dependent. And last is dependent. Dependent is a family member of insured person, like spouse, children and parents. A dependent can be a beneficiary but not an insured. Next is insurance. In most cases patient purchase to health insurance to reduce the financial risk. But sometimes patient purchase more than to insurance as well. With multiple insurance policies, the concept of primary insurance, secondary insurance, tertiary insurance and so on come into existence. Let's discuss about primary insurance first. Primary insurance. Primary insurance is a policy that pays for coverage first, even when the policyholder has other policies that cover the same risk. Those other policies will only be tapped when the primary policy has reached its financial limit. Next is secondary insurance. Secondary insurance is a health insurance plan that covers in addition to primary insurance plan. Typically, secondary insurance is billed when primary insurance plan is exhausted and may help cover additional health care costs. For example, if you already have insurance through your employer and choose to enroll with your spouse's health insurance plan, if allowed, that coverage would become your secondary insurance. After secondary insurance, tertiary insurance plays its role. The word tertiary literally means third, so a tertiary insurance policy provides coverage beyond an insured party's primary and secondary policies. The tertiary insurance company works with the other two insurers on coordination of benefits. An agreement on which company will pay which part of a claim. When someone purchases a insurance, he gets insurance ID, policy effective date, policy termination date, and he has to pay premium amount. Let's understand insurance identification number. It is a number assigned by insurance company to the person who is buying a health insurance policy for himself. This number is mentioned on the insurance card. It is also known as member ID, subscriber ID or policy number. Let's understand policy effective date. Policy effective date is the date from which an insurance policy become effective and start covering the policyholder healthcare expenses. Let's understand policy termination date. Policy termination date is the date from which an insurance policy become inactive and stop covering the policyholder healthcare expenses. Let's understand policy insurance premium. Premium is the amount a subscriber policyholder pays to buy a policy, keep a policy active. This amount can be paid monthly, quarterly, half-yearly or yearly. After understanding the provider, patient, and insurance, our next topic is amount. So, let's understand the billed amount, allowed amount, insurance payable amount, and right of contractual adjustment amount. These amounts come into existence once a claim for medical services billed to insurance. First, what is billed amount? It is the amount charged by a provider as compensation for the services provided by him. The billed amount will reflect on the claim against the treatment that was performed. Next, allowed amount. Most insurance companies have a fixed payable amount for each of the different services performed by the physicians. They fix the amount based on various in-house calculations like cost of the treatment, geographical location of the practice, average charge of all physicians for that procedure, etc. Insurance companies will pay the allowed amount regardless of how much the physician bills. Insurance payable, it is an amount that insurance will pay to the provider. Then, right of contractual adjustment, when the physician's billed amount is more than a participating insurance company's allowed amount, then the insurance company pays its allowed amount, and the difference between the billed and the allowed amount will be written off or adjusted. Billed amount is equal to allowed contractual write-off. Allowed amount is equal to billed contractual write-off is equal to insurance payable amount. Patient responsibility. Patient responsibility amount is equal to allowed insurance payable amount is equal to billed amount insurance payable amount contractual write-off. The amount billed by providers normally splits into three parts: insurance payable amount, contractual write-off or provider adjustment, and patient responsibility. Let's understand what is the patient responsibility amounts. The amount left after insurance payment and provider write-off is normally a patient responsibility amount. It can also be called as an out-of-pocket expense. Let's understand its definition. Out-of-pocket expenses, a medical bill or a part of medical bill paid by a patient out of his own pocket because of non-payment of his insurance company or because of the instructions from his insurance company, is called an out-of-pocket expense. Deductibles, coinsurance, copayment and balance bill fall under out-of-pocket expenses. It is a fixed dollar amount. Once this amount meets, insurance companies pay 100% on the claim. Next, what is deductible? This is an initial and fixed amount paid by the patient to the provider as medical expenses before his/her insurance starts paying for the services. Some insurance companies have a yearly deductible, which means that money should be paid by patient before his/her insurance starts paying medical bills for that year. Other insurance has a lifetime deductible, which means that the patient will have to pay for his treatment until a certain limit, and then the insurance would start paying till his coverage is valid. Next, what is coinsurance? A percentage cost share between a patient and his different insurance payers is called as coinsurance. It is a percentage of the allowed amount that a patient is required to pay, which may be in addition of deductible and copay. Next, what is copay? It is a nominal amount, just like a consultation fee, which a patient needs to pay on every visit till out-of-pocket expenses not meet. Balance bill. When a non-participating primary insurance company pays a part of a claim, the balance on the claim can be billed to the patient or the secondary insurance. This is called balance billing. The balance bill would therefore be the difference between the physician's billed amount and the non-participating company's allowed amount for a service. Things to remember: an out-of-pocket maximum is the most a patient has to pay per year for covered healthcare services. When a patient has spent this amount in his plan year on deductibles, copayments, and coinsurance for in-network care and services, his health insurer will pay for 100% of his healthcare services. PR1 is the reason code used to mention the deductible amount on insurance EOB. PR2 is the reason code used to mention the coinsurance amount on insurance EOB. PR3 is the reason code used to mention the copay amount on insurance EOB. Our next topic is patient-provider documents. First, coordination of benefits. When a person is covered by two health plans, coordination of benefits is the process the insurance companies use to decide which plan will pay first for covered medical services or prescription drugs and what the second plan will pay after the first plan has paid. Second, assignment of benefits. Assignment of benefits in the context of health care refers to an agreement or arrangement between a beneficiary and an insurance company, by which a beneficiary requests the insurance company to pay the health benefit payment directly to the physician or medical provider. The patient or guardian signs the assignment of benefits form so that reimbursement checks will be sent directly to the doctor or medical provider. Third, explanation of benefits. An explanation of benefits, EOB, is a document that a health plan sends to a member and healthcare provider after a medical claim is processed. The EOB will show a variety of information, including details about the medical treatment, the amount that was billed, the amount that the health plan allows for that service, the amount the health plan paid, if any, and the amount that the patient owes. It is a statement that describes what costs the plan will cover for medical care or products a patient received. Fourth, medical records. A medical record is a written account of a person's medical information. It includes medical history, care or treatments received, test results, diagnoses, and medications taken. A medical record is usually created and maintained by a healthcare provider. Fifth, letter of medical necessity. A letter of medical necessity, LMN, is a document from your licensed healthcare provider that states a treatment, product, or equipment is medically necessary and therefore should be covered by insurance. The letter often includes relevant patient history, medical needs, and the duration of the treatment. It is the formal medical judgment of a licensed professional and a legal document that states the doctor's clinical decision-making recommendation. Provider type. In the start of this video we discussed about rendering, referring and primary care provider. These providers are further categorized as participating provider or non-participating provider. Let's understand. Participating provider, a provider who has contracted with the health plan to deliver medical services to covered persons. The provider may be a hospital, pharmacy or other facility or a physician who has contractually accepted the terms and conditions as set forth by the health plan. And a non-participating provider. A non-participating provider is a person or entity that provides healthcare services but does not have a written agreement with a managed care organization or a Medicare plan. A non-participating provider may charge more than a participating provider and may expect full or upfront payment from the patient. Next topic is claim form types. The medical claims are always billed on standard forms. There are two types of form used in US healthcare. First, HCFA 1500 CMAs 1500. The form CMAs 1500 is the standard paper claim form used by healthcare professionals and suppliers to bill Medicare carriers or Part AB and durable medical equipment Medicare administrative contractors, AB Max and DME Max. Second, UBO4. Standard claim form used to bill hospital inpatient and outpatient services or clinics, or any provider billing for facility fees similar to CMAs 1500. Next topic is place of services. It refers to the physician location where the service is performed. Like office, hospital, etc. Common place of service and codes used in medical billing. Office, 11, home, 12, urgent care facility, 20, inpatient hospital, 21, outpatient hospital, 22, emergency hospital, 23, skilled nursing facility, SNF, 31, hospice care, 34, other place of service, 99. Other healthcare terminologies. First, birthday rule. If a child is covered under both parents' health plans, a provision known as the birthday rule comes into play, guiding how the coordination of Benefits will work. The birthday rule says that primary coverage comes from the plan of the parent whose birthday, month and day only comes first in the year. The other parent's health plan then provides secondary coverage. Second is claim, a medical bill that is sent to an insurance company for processing. Third is inpatient, a person admitted to a hospital for medical care and stays in the hospital for more than 24 hours. Fourth is outpatient, a person who receives treatment in a physician's office or a hospital but does not require hospitalization when a patient stays in the hospital for less than 24 hours. TOB, type of bill, a bill that shows what type of care is being billed, such as hospital inpatient, hospital outpatient, skilled nursing care, etc. These are 3-digit numeric codes used on hospital claim. Example, inpatient, original claim, TOB 111, inpatient, corrected claim, TOB 117, outpatient, original claim, TOB 131, outpatient, corrected claim, TOB 137, claim filing limit, a time limit under which claim should be filed with the insurance companies to qualify for reimbursement. All insurance companies have their own filing limit. The insurance companies would reject the claim if they aren't filed or received within the specified time frame. Capitation. Capitation is a fixed dollar amount per plan member per month paid to providers regardless of medical utilization. The payment structure shifts the financial risk from the insurance company to the physician or hospital accepting payment. Example, Athna pays Dr. Johnson $20 per member per month to care for all Athna patients who have Dr. Johnson as their primary care provider. If Dr. Johnson has 100 Athna members assigned to him, he will get $2,000 per month to provide care to all the members. Medicare crossover. Crossover is the transfer of processed claim data from Medicare operations to Medicaid agencies and private insurance companies that sell supplemental insurance benefits to Medicare beneficiaries. Insurance claim number, a number given to a medical service by insurance company. ABN, Advance Beneficiary Notice. An Advance Beneficiary Notice, ABN, is a notice that a provider gives to a Medicare beneficiary before providing a service or item that Medicare may not pay for. The ABN informs the beneficiary of the reason why Medicare may not cover the service or item and the estimated cost. The ABN also allows the beneficiary to choose whether to accept the service or item and be responsible for the payment if Medicare denies it. The ABN is required for certain services and optional for others. The ABN is only used for beneficiaries in original Medicare, not Medicare Advantage plans. HIPAA, Health Insurance Portability and Accountability Act, 1996. This federal act sets standards for protecting the privacy of your health information. NPI. A National Provider Identification Number is a unique 10 digits identification number issued to health care providers in the United States by the Centers for Medicare and Medicaid Services. Tax ID number, a number assigned by the federal government to doctors and hospitals for tax purposes. CMA's Centers for Medicare and Medicaid Services, the federal agency that runs the Medicare program. In addition, CMS works with the states to run Medicaid program. CMS works to make sure that the beneficiaries in these programs are BLE to get high-quality healthcare. SSN, Social Security Number in the United States. A Social Security Number, SSN, is a 9-digit number issued to U.S. citizens, permanent residents and temporary, working, residents. MRN. Medical Record Number, the number assigned to the patient by the doctor or hospital that identifies the patient's medical records. Account Number, number given to the patient by the doctor or hospital for medical visit. Encounter Number, encounter hash is assigned for each dose separately by providers to their patient under an account hash. Date of service, the dates when a treatment or healthcare service has been provided. Date of bill, the date when bills are prepared. It is not same as the date of service. Credentialing, the process of obtaining, reviewing and verifying a provider's credentials. The documentation related to licenses, certifications, training and other qualifications for the purpose of determining whether the provider meets the MCO's, Managed Care Organization, pre-established criteria for participation in the network. The standard form used for credentialing is W-9 form, fee schedule, a list of all the medical services and the allowed amount, predetermined prices on all the medical services, is called a fee schedule. This can be obtained from any insurance company and can be used to verify the payments made by the insurance company. Contract maximum. Some insurance companies have a maximum payable amount on certain illnesses or policies. The insurance policy may say that it will pay a limited amount on a specific illness or a limited amount for a calendar year. The total amount payable on a patient's policy based on his/her contract is called the contract maximum. For example, a patient may be covered for $5,000 per year for dental surgery. If the patient's dental surgery bills exceed that amount in a calendar year, then he/she will be responsible for the excess referral approval needed for care beyond that provided by primary care doctor or hospital. For example, managed care plans usually require referrals from primary care doctor to see specialists or special procedures. Pre-authorization pre-certification. Prior authorization in healthcare is a requirement that a provider, physician, hospital, etc. obtains approval from health insurance plan before prescribing a specific medication or performing a particular medical procedure. Without this prior approval, health insurance plan may not pay for treatment, leaving a responsibility for the full bill to patient. Thanks for watching. Please like, share and subscribe.